Hi, today we will talk a bit about what we call as dysfunctional voiding or voiding dysfunction in children. Now, in my practice, I see a lot of children who come with urinary symptoms. In some of these children, these urinary symptoms are because of a congenital problem or a, a problem with a manufacturing defect with the urinary tract, which obviously happens when the baby is in the mother's womb, and some of them can cause urinary issues after birth. But there is another group of children who have normal kidneys and normal urinary bladder, essentially a normal urinary system at birth. But later on, they present with urinary problems. Typically, such children typically are school going, usually of school going age. Girls have this problem more than boys, and they come with a variety of symptoms, including urinary infections, typically with burning of urination, or increased frequency of urination, urgency of urination, or sometimes a little blood coming in the urine, which is again because of severe urinary infection, or sometimes even involuntary leakage of urine, which we call as incontinence. So they they do not have any structural abnormalities of the urinary tract to begin with, but they they have abnormalities, secondary abnormalities or functional abnormalities of the urinary tract, which develop because of what we can easily or simply call as bad habit. So broadly, this is called as, because it's a functional problem, this is called as a dysfunctional voiding or dysfunctional elimination syndrome or voiding dysfunction. So typically, 5 or 6 year old girl, typically school going girl, comes with symptoms of increased frequency of urination, urgency of urination, and sometimes involuntary leakage of urine into the undergarments. If you do an ultrasound examination, typically they have a little thick walled urinary bladder, and they have usually they have normal kidneys, unless it becomes very severe where it starts showing effects on the kidneys also. Otherwise, they usually have normal kidneys. And if you take a proper history, these children typically they hold urine. They do not go to the toilet and pass urine even when their bladder is full. So that's one of the typical situations where the bladder becomes chronically distended, chronically full, and irritated, and will give rise to functional problems in the bladder. So they don't drink much water. Probably the toilets in the school may not be very clean, so they do not want to go to the toilet. So first of all, they don't drink much water. Their urine gets concentrated, and even when the bladder is full, they do not go to the toilet and pass urine. So this becomes a cycle, and this causes bladder dysfunction. And whenever sometimes you see these children, whenever their bladder is full, they cross their legs and try to hold on to the urine, especially because they are scared that some urine might leak involuntarily into their undergarments. And a little more depth into the detailed history will reveal that most of these children may also be constipated. So they don't go to the they don't empty their bowels properly. And in more severe situations, some of them may have a little bit leakage of stool also into the undergarments intermittently. So again, this can be a very early stage or it can be an advanced stage, and in very severe cases, this dysfunctional voiding can lead to bladder changes and even changes in the upper urinary tract like swelling in the kidneys and recurrent kidney infections and sometimes even kidney damage. So the identification of this child or diagnosing is pretty straightforward. Because the history, if you ask the parents and if you ask the child the typical history, usually the history will be forthcoming. If we just do an ultrasound just to rule out any other serious problem. We also do a simple X-ray of the tummy, which shows a lot of fecal impaction in the intestine, which shows that the child is constipated. Because many times the parents would tell you that this child is going to the toilet and passing motion. But how do you know what the child is doing inside the toilet? The child is maybe just sitting there and coming out after 5 minutes, or maybe just playing there. So a simple X-ray of the abdomen will many times reveal that this child is probably constipated. Now, once we know this, and once we have ruled out that the bladder or the upper tracts have become very abnormal, then the treatment is mostly behavioral treatment. The treatment of these conditions generally does not require much of a medication unless it is in a more advanced condition. So the initial treatment is teaching the parents how to teach the child to pass urine and motion normally. See, unfortunately, many of these children, they get up in the morning and go to the school before they have enough time to pass a motion. And many times the school, even in so-called good schools, the toilets, they may be clean in the morning, but once a few children visit the toilets typically become dirty. They are usually not as clean as the toilets at home are. So many children, especially girls, do not want to go and sit there and pass urine. And the school may be very far from home. So by the time the child takes the bus and comes home, again it may be an hour or two of traveling when the child doesn't have a chance to pass urine. So typical history is they come home and they run to the toilet to pass urine. This is a very typical. That means they have been holding on to that urine since morning, since they have gone to school, till they come back from the school, they have been holding to the urine. So most parents, once they hear what I am saying, they will easily know whether their child has this problem or not. So all that is required is, we call it urotherapy, but let's make it very simple. Basically, drinking adequate water and then visiting the toilet whenever there is bladder sensation or bladder is. When the bladder is full, it gives a sensation, it gives an alarm. So that time you have to visit the toilet. The other way is to get the child into a timed voiding schedule. That is, the child can go to the toilet and pass urine every 2 or 2.5 hours, once every 2 or 2.5 hours, especially in daytime. It need not be done during the night time. And then, of course, treating the constipation. Again, because of the modern diet with less water intake, less fiber and roughage intake, most of our diets have become westernized. So constipation is a major problem in the Western world, which again we seem to be inheriting from the Western world. So the Indian diet, which is rich in vegetables, green leafy vegetables and fruits, is very good to avoid constipation. So dietary modification, and then toilet training, to go and sit on the potty every day and empty the bowel, spend some time and empty the bowel, and make it a habit. So basically, developing good habits, inculcating good habits in the children, and the parents have to keep an eye and see that the child follows these things. In early cases, when you pick these dysfunctional problems early, this kind of behavioral treatments and change of habit is good habits is getting into good habit is more than sufficient. But in advanced children, sometimes they have kidney infections, sometimes they have bladder problems. So then you may have to treat them with medication. You may have to do a uroflowmetry or electromyography or sometimes rarely urodynamic studies to come to a conclusion as to what is happening. A few further tests may be required. And then this child may need to be put on some medication. Sometimes they may need to be put on a schedule of what we call a CIC, that is intermittent emptying of the bladder, and very rarely they may require surgical treatment. Our aim is to educate the parents that because it's a functional problem and it's very easily recognizable by the signs and symptoms, all parents should keep an eye on their child's urinary and stooling habits. And if they find any of these symptoms and signs that I have said, they should try to consult the appropriate doctor, take advice, and then in the early stages itself, if we can manage these children by developing good bowel and bladder habits, then we can prevent major issues developing because of this to the urinary tract.